Jarrett Parker is currently an outfielder for the San Francisco Giants. He's 28 years old and he was drafted in the second round of the 2010 MLB draft. He's currently in a $539,000 deal with the Giants. You are now about to watch what exactly happens to Jarrett Parker on Saturday's game, April 15th, against the Colorado Rockies. And in case you missed it the first time, here it is again, Jarrett Parker colliding with the wall. As seen in this picture, it's Jarrett Parker's distal 1/3 of his clavicle that is slammed into the wall. The mechanism of injury would be a direct blow. He wasn't paying attention to how close he was to the wall when he was running back, thus causing him to crash right into the wall. The clavicle, also known as the collarbone, is located in the upper chest. It is part of the shoulder joint that provides stability during arm movements. Clavicle fractures are quite common and often occur due to trauma. Things such as car accidents, direct blows, and sports injuries are often where you will see these happen. Some symptoms include hearing a snapping sound as soon as it breaks, immediate pain following, pain with movement, bruising and swelling, and sometimes if the broken bones are displaced, you might see a possible bump as well as a shoulder being slumped forward. One method to treat a fracture would be limited immobilization, such as putting the patient in a sling and providing pain medication. Now, surgery would be required for fractures that don't heal, broken bones that pierce through the skin, and bones that threaten nearby structures. As he comes away from the wall, one huge sign to let us know that he fractured something would be watching him cradle his arm close to his body. That lets us know that he's in immediate pain, as well as the fact that he's actually holding his clavicle. The first line of care for his injury would be the athletic trainer coming out and running onto the field to help him. After leaving the game April 15th, he is then diagnosed with a broken clavicle. He is placed on a 10-day DL list and undergoes surgery April 16th. Since we don't know the depth of his injury or how serious it was, his return to playtime might be longer or shorter than what is expected. Average time for the break to heal would be 6 to 8 weeks, and most likely returning to play within 3 months. During that time off, he would need to gain strength, balance, and mobility back in order to use that shoulder again. Following his surgery, here are a few ideas for exercise that he could do to gain his strength back.
Exercises that we can do is a plyometric external rotation exercise. What we have JP do is lay on a table or a surface with his arm in the 90-90 position. He'll hold on to the ball, and he's going to throw and catch the ball at a quick pace. Good, you can let it drop a little bit more. Good. This allows the external rotators to function more plyometrically and eccentrically. The next exercise we're going to do is a thrower-specific exercise called a deceleration. The purpose of the exercise is to allow the rotator cuff muscles to function in a deceleration type of contraction while they're elongating. Again, this is a thrower-specific type exercise. What we're going to have JP do is hold his arm into a 90-90 position. He'll look over his shoulder as I toss him the ball. You'll see as he catches the ball, he decelerates it and tosses it back to me. Variations to this exercise are to throw the ball faster and with more velocity, allowing JP to decelerate